Hello and welcome. It's 11 a.m. here in Seoul. I'm Choi Jung-yun at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Yoon Tae-ho, the overall officer of disinfection at the Central Disaster Management Headquarters, will be briefing us on the coronavirus situation here in the country. He will fill us in on the number of new infections as of midnight and the efforts that the government is making to contain the virus. To give you a brief idea as we wait, South Korea reported 731 new cases of COVID-19 on Wednesday, marking the highest daily tally in almost 100 days. 714 of Wednesday's total cases were local transmissions, with over 71% of them coming from the greater Seoul area. Now let's take a listen to the briefing.
반장이 코로나19 대응 방안 등을 설명하겠습니다.
Let us now begin our regular briefing for April 14th, Wednesday. As of today midnight, we have 714 new local infections and 17 new imported cases. Currently, there are 100 patients with critical or severe conditions, and they account for about 1.3% of total people who are currently in quarantine. And we have about 619 hospital beds available for critically ill patients. And as for those in mild and moderate symptoms, we also have more than 10,000 hospital beds. And yesterday we had 7 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. During the past weekend, we have seen 71 million foot movement of traffic, which is a significant on-week increase. And a majority of them came from the metropolitan area, which was about 10% on-week increase. And also in non-metropolitan area as well, we saw some 19% on-week increase as well. And we believe that these levels are similar to November when it was before the third major outbreak. And we believe that these movement increase was due to the seasonal factors. However, we believe that this also tells us how we became complacent about the quarantine measures. We need to remember and take continued particular precautions for COVID-19, the virus, as it can infect any one of us. And the principle of preventing the COVID-19 infections remains unchanged and is based on scientific evidence. It is all about reducing physical contact and also taking part in quarantine measures. And 714 new local infections have been reported here in Korea, which is the highest tally since seen over 3 months. And we have seen a continued rise in the daily tally for the past several weeks. In order to contain the virus going further, it is very crucial for us to contain the virus and also ask for your participation in quarantine measures going forward. When our third wave peaked in last winter, we believe that at nursing hospitals and long-term care centers, which house many senior citizens, these facilities were prone to cluster infections, leading to a high number of fatalities. And to this response, the government has carried out weekly regular PCR testings for all of the people who are working and residing at these facilities. And also starting from February, we began the vaccination rollout here in South Korea. And thanks to those efforts, we have contained the virus at these long-term care centers and nursing hospitals to a large extent. And in December, we have more than 1,400 people who were infected. However, lately, we have seen only some 34 infections, and we believe that there are on average 4 infections out of every cluster, every nursing hospitals and also long-term care centers. And we also have seen the infections decrease from about 5.6% to about 2% range lately. And thanks to this large decrease in the number of infections at these facilities, we also witnessed a decrease in the number of fatality as well. And thanks to your efforts, we have been able to contain the virus to a large extent. So we would like to extend our deepest appreciation to all of the workers and residents of the nursing hospitals and long-term care centers. And as we all know, the COVID-19 virus is especially detrimental to the senior citizens. And the overall fatality rate here in South Korea stands at about 1.6%. However, those above the age of 80 see about 20% range of fatality rate and about 1.4% range in the those in the 60s. However, those under the 50s, that is, we see a significantly lower level of fatality. And also, starting from the February and until mid-June, we will be carrying out the vaccinations focused on the senior citizens. And we believe that if this vaccination becomes a success, we can decrease the infections going further and also decrease the fatality rate. We have began to roll out the vaccinations for the senior citizens over the age of 75, as well as those over the age of 65 at nursing hospitals and long-term care centers, and we believe that this will contribute to a decrease in the number of fatality rate going further as well. And this will also help us to secure more hospital beds as well as other medical equipment and supplies. And the government will also continue to exert our full effort to contain the virus to this end. And we ask for your continued participation as well. And this is something that I long for as well. And in response to possible massive outbreak, we are securing more hospital beds, and we have about 5,000 beds at the life treatment centers and about 8,000 beds at the COVID-19 hospitals, and also critical hospital beds are also available, and we have more than 15,000 hospital beds available for all of these patients. And we also have much room for available for use at the COVID-19 hospitals as well as other types of treatment centers. This means that we can respond to these infections even if we have about 1,000 daily tally. And to this end, the government will also continue to secure more hospital equipment and also medical capacity so that we can deal with the daily tally of around 2,000. And we will secure more hospital beds to this end. And at life treatment centers, if needed, we can also increase the number of accommodations, and we will be also rolling out preparations to secure more life treatment centers. And at around 11 facilities nationwide, we have completed the negotiations for using them, and we have about 15 centers which can be open in the near future. And we also have additional facilities that can be utilized going further, stationed across the country. And as for the designated infectious disease control hospitals, we will be designating more hospitals to treat the infectious diseases, and we have about 4 hospitals that will be designated in advance, and we will secure about 400 hospital beds as well. We believe that these preparations are aimed at being prepared for any possible massive outbreak. However, it is very crucial that we contain the virus to a large extent. Today, we had about 500 daily tally in the metropolitan area, and thus we have higher risks of infection in these areas, ranging from daily venues, including workplaces, indoor sports facilities, as well as restaurants and cafes. And we are seeing repeated cluster infections breaking out at these venues that have also been prone to large cluster infections in the past. So it is also very important that our public complies with the quarantine measures measures, so please refrain from having gatherings if they are not necessary. And please also meet in small groups at outdoors rather than confined indoors. We ask for your participation in the quarantine measures once again. And we also would like to note that individual public is the responsible agents of COVID-19 containment, and we would like to also extend our deepest appreciation to all of the elderly who have already been vaccinated. And if you are still concerned about the vaccines, please also get vaccinated. Thanks for the sake of your safety and those of others as well. The government will also make sure to exert our full efforts to return to a state of normalcy. We will also exert continued efforts. Thank you very much.
지금부터 질의응답 시간을 가지겠습니다. 배석자분들은 단상 위로 올라와 주시기 바랍니다.
That was a government briefing on the COVID-19 situation here in the country. South Korea reported 731 new COVID-19 cases on Wednesday, and this brings the accumulated number of cases to 111,419. There have been 7 more deaths, raising the death toll to 1,782. We'll wrap up the coverage here, but we'll be back at 12 p.m. Korea time for our midday news with Mark Broom. Bye for now.